civil society, labor, business, and health professionals who are here, senior government officials who are here, members of the media, good morning, ladies and gentlemen. Is it? Oh yeah, it's already afternoon. It's been a long morning. Good afternoon, ladies and gentlemen. The Presidential Health Compact is a presidential initiative established by President Cyril Ramaphosa in 2019. The Compact is a framework of cooperation between critical sectors in South Africa that significantly influence good health outcomes. It has a monitoring and evaluation component where roles and responsibilities are assigned to a broad range of stakeholders to support health systems, strengthening and preparation for the implementation of the National Health Insurance. In 2018, President Ramaphosa held a Presidential Health Summit to address the pervasive challenges in the health system and to fix the problems. The first compact emanated from the resolutions of the summit and was implemented between 2019 and 2024. Last year, the President reconvened the stakeholders to take stock of the health compact process and renew the social contract for 2024-2029. The process produced a second Presidential Health Compact whose signing we are here to witness today. To warm us up for the signing, please welcome Minister Aaron Motsoaledi, who will deliver brief remarks. Thereafter, invite the acting president to the podium to deliver his address. Minister. I think we can do better with a round of applause. That's much better. Thank you.
Yeah, I was asking if I'm allowed to stand here, President, because this is union building, you see. You don't just do things the way you do in the Department of Health. Program Director, spokesperson of the Presidency. My colleagues, the Minister of Science and Innovation, Dr. Bladen Zimande, Deputy Minister of Health, Dr. Joe Pasha, Deputy Minister of Science and Technology, Deputy Minister Gina, my MECs, brand new ones and old ones. I see Rauten there, Limpopo, Mpumalanga, Free State, Northwest, Northern Cape. Welcome, welcome, colleagues. I'm sure this is your first gathering here at government level since your appointment. We welcome you. Leaders of sectors in health, academia, community, labor, and business. In 2018, the President convened a broad range of stakeholders working within the health sector to discuss the state of our public health sector, chronic and emerging challenges, but more importantly, the main objectives were to achieve consensus on a set of actions we will jointly undertake to improve the provision of healthcare services, use our collective and strategic advantage to develop and implement sustainable solutions for the healthcare system. This gathering, entitled the Presidential Health Compact, was a first, and there was a lot of optimism and enthusiasm among those present because they regard it as a new way dealing with ongoing and emerging issues in the healthcare system. Until then, the Department of Health was expected to carry the weight on its own. Unfortunately, before any concrete action was taken, the country was then hit by COVID-19 pandemic, which, in addition to bringing the country to a stop, put paid to any plans contained in the compact. Although the impact of this pandemic was felt across all sectors and households, the health system withstood the most of this devastating disease. Challenging as it was, the pandemic exposed other hidden weaknesses in our system, thus enabling us to ensure these are addressed in the second plan of the health compact. The HIV/AIDS pandemic did not only expose weaknesses in South Africa, it actually exposed weaknesses globally. That's why, as I'm standing here in front of you today, our former Director General of Health, Precious Matsoso, is chairing a special committee in Geneva, which is working on pandemic preparedness for the whole world, because we were never ready when when COVID-19 struck. It is hoped that at some stage, the World Health Organization will call all ministers of health for a special meeting to adopt that pandemic preparedness plan. It will be historical because ministers of health meet once every year in Geneva, and they meet in May, and they've already done so. If they are called for the second time, it will show the seriousness of the world about what needs to be done. We are now at the point where the compact must move into action, and improved health outcomes and impact be felt. We are ready to get our marching orders from you, Acting President and President Ramaphosa. We're very ready. Now I want to take this opportunity to introduce to you His Excellency, our Deputy President, Mr. Paul Mashatile. If I'm not mistaken, now sit down, Deputy President, Acting President. I'm still introducing you because you'll intimidate me when you stand up and I won't be able to go on. The Deputy President, which I think you all know, is one of the few of us who never skipped any step. He has been an MEC. He has been a minister. He has been a premier. He's now the Deputy President. I won't go beyond that because I've not given the mandate. It is the opportunity now, Acting President, to address us. Yes, I forgot. He is now the Deputy President and is Acting President, and I stop there. I can't go beyond. Thank you.
Thank you. Thank you very much. You may be seated. Thank you, Dr. Aaron Motsoaledi, for the introduction. Let me also recognize Minister of Science and Innovation, Dr. Blade Nzimande, and the Director General of Health, Dr. Sandile Buthelezi, all the DGs here present, MECs from all our provinces. You are most welcome. Representatives of the health fraternity, representatives of business, labor, and civil society, all the guests, ladies and gentlemen, good afternoon. You are welcome to my house. The Roman poet Virgil is reported to have said that the greatest wealth is health. This is especially true when it comes to the health of a nation. A healthy nation is more economically productive and prosperous. A healthy population enjoys higher life expectancy, better quality of life, and overall well-being. That is why delivering quality health care is paramount. South Africa is committed to the achievement of the United Nations Sustainable Development Goals. We are committed to the SDG goal of ensuring healthy lives and promoting the well-being of all at all ages. This is a bold commitment to achieve universal health coverage. It is a commitment to provide access to affordable medicines and vaccines for all. If our nation's health is truly to be our nation's wealth, we must fix our healthcare system. A better healthcare system improves health outcomes, increases life expectancy, and lowers the burden of disease. This enables us to better protect the population against public health emergencies, whether it be HIV and AIDS, COVID-19, as the minister just indicated, Mpox, and others that are yet to come. A well-functioning health system improved access to care and quality of care. It enables us to make more efficient use of valuable resources, from human resources to medical supplies to technological and financial resources. This results in lower healthcare costs for individuals, for families, and also communities and government. However, our public healthcare system has many challenges. These challenges prevent government from providing decent quality health care to all South Africans. It is for this reason that in 2018, as the minister indicated, we convened the first Presidential Health Summit. This brought together many stakeholders engaged with the health system, including policymakers, academics, planners, service providers, educators, health advocates, and users. This resulted in the signing of the first Presidential Health Compact. Together we made a commitment to support the Department of Health to implement the 9 pillars of that compact. These pillars include improving human resources, capabilities, and expanding access to medicines. They include ramping up health infrastructure, development, and steadily improving the quality of health services. We made a commitment to better financial and information system management, good governance, and community engagement. We affirmed the important role played by the private sector in strengthening health systems across the board. Today, Program Director, we will be signing the second Presidential Health Compact. This is an opportunity to reflect on progress since the signing of the first compact. The introduction of the Human Resource Training Grant during the COVID-19 pandemic enabled the department to create more than 73,000 new posts. The private sector also continues to support the workforce development, health workforce development. For example, the Public Health Enhancement Fund has trained 100 doctors and 75 master's and doctoral graduates. Access to medicines, medical devices and equipment have been expanded. New technology is being used to improve supply chain mechanisms, streamline regulatory processes, and reduce backlogs. The development of local manufacturing capabilities is being prioritized to expand access to medicines. We have been consistent that building a stronger local manufacturing industry is key to our country's health security, especially during pandemics. Technology is being harnessed to improve patient record systems. During the pandemic, we were able to speed up this process. By last year, 50 million people had been registered on the health patient registration system. We are expanding our health infrastructure. By November of last year, 149 new primary health care facilities had been completed. 30 new hospitals are either opened or are under construction. We are implementing the National Quality Improvement Plan to ensure that more public and private facilities meet the Office of Health Standards compliance requirements. This is in line with the requirement of the NHI. The National Quality Improvement Plan has led to an increase in positive patient experiences at public health facilities. Positive experiences reported by patients rose from 76% in 2017 to 85% by March of this year. Healthcare funding faces challenges due to budget cuts and a constrained fiscal environment, compounded by, amongst others, inefficiencies, mismanagement, and corruption in resource allocation. Budgeting in the health sector is steadily improving to ensure a more equitable allocation of resources. Less money is being lost to litigation. This is thanks to the hard work of the Health Sector Anti-Corruption Forum, which continues to expedite prosecutions and recover stolen funds. The private sector has a crucial role to play in strengthening health systems. Our experience with COVID-19 showed how we could deepen public-private partnerships. With greater collaboration, the resources and capabilities of both the public and the private sectors can be brought to bear to serve those who need health care the most. With the NHI Act now signed into law, it is even more urgent that we work together. As we implement the NHI, we will build on lessons learned to streamline standards and ensure quality of care, whether it is rendered at a public or private facility. We need diverse expertise as we work towards strengthening health systems and building their resilience for the future. We need to share resources to ensure that programs are implemented. Involving the private sector, labor and civil society throughout this effort is key to ending inequality in healthcare. It is up to us to build on the successes of the first presidential compact. We need to ensure that the second presidential health compact that we are signing today is responsive to the challenges facing our health care system. To all our partners, we say, please keep up the good work. Continue to demonstrate the progress that we are making and deepen collaboration so that we overcome these challenges. Our nation's health is too critical, too essential to development, to be weakened by mismanagement, funding crisis, or other problems. We expect all stakeholders to bring solutions and work with the Department of Health and Science and Innovation to implement them. Implementation is the foremost priority of this seventh administration. Program Director, I have full confidence that implementation is a priority of all of us as we are gathered here this afternoon. I therefore wish all of you well and hope that working together we will indeed succeed. Thank you very much.
Thank you very much, Your Excellency. I think after the acting president has so warmly welcomed you to his house, you can do better with that round of applause. Thank you very much. We will now commence with the signing ceremony. To kick off the signing is Minister Aaron Motsoaledi, Dr. Aaron Motsoaledi, and Minister Dr. Blade Nzimande. If we may please assist the ministers to start with the signing. Or before the ministers, I beg your pardon, it's the acting president first that signs. Thereafter, the ministers will follow. Thank you. Thank you very much. Minister Motsoaledi. Please don't impede the cameras. Thank you. Thank you very much. I'd like to invite the MECs present, the deputy ministers present, and the Director General from the Department of Health to just join the acting president and the ministers for a picture before we invite other social partners for the signing. The MECs present, the deputy ministers, the Director General from the Department of Health and other DGs present, please come forward and join the acting president and the ministers for a picture. Thank you. Yes. Yeah, please hold the books up to the audience and the photographers. Thank you very much. Photographers, please be considerate of your colleagues at the back. Thank you. Okay, thank you very much. Thank you very much. I'm now going to invite the social partners, in no order of importance, to come forward for the signing. We will start with Dr. Ndedzako, who is the country director representing the World Health Organization. Please come forward, sir. As Dr. Ndedzako makes his way to the front, I'd like to invite a representative of business, Mr. Khabo Cedric Komape, from the Independent Community Pharmacy Association. We can just assist them to sign quickly so that we can proceed with the next batch of signatories. Thank you. Thank you very much. As they're signing, I'd like to get Mr. Mabalane Mfundisi from the South African National AIDS Council Civil Society Forum ready to come forward. Mr. Mfundisi will be followed by Mr. Jabulani Mqitagali from the Defend the NHI campaign. If they may please start making their way to the front. Okay. Once the signing has been concluded, we'll just take a picture and then we will release the signatories. Thank you. Thank you very much. Thank you very much to Dr. Ndenzako, and thank you very much to Mr. Khabo Cedric Komape. Thank you. We will now have Mr. Mabalane Mfundisi from SANEC Civil Society Forum and Mr. Jabulani Mqitagali from the Defend the NHI campaign. As they're signing, I'd like to invite Dr. Cedric Sihlangu from the South African Medical Association Trade Union, SAMATU, to be followed by Ms. Boitumelo Molete, representing the Congress of South African Trade Unions. Okay, thank you very much. Ms. Dr. Cedric Sihlangu and Ms. Boitumelo Molete, please join the signing. Thank you. Smile for the picture. Thank you very much. As they're smiling for the picture, I'd like to invite Mr. Kaya Sotiti from the Democratic Nursing Organization of South Africa, TENOSA, to be followed by Ms. Lauren Pretorius from Campaigning for Cancer. Please come forward and join the signing. Thank you. Okay, we smile for the picture after signing. Thank you very much to Ms. Lauren Pretorius as well as Mr. Kaya Sotiti. I'd like to now invite Dr. Jonas from the South African Medical Research Council to come forward, and he will be joined by Mr. Mukhulukhulu Pasha from the South African Pharmacy Council. Thank you very much, Ms. Pretorius. Thank you. Once Mr. Pasha has signed, we pose for the picture. We smile. Thank you very much. And lastly, I'd like to invite Mr. Soli Nduku from the National Unitary Professional Association for African Traditional Health Practitioners of South Africa. I won't read the abbreviation. Mr. Ndugu is the last of the signatories. Once we complete the signing, I'd like to then invite all the signatories to the front for one final group picture with the acting president the ministers. I'd also invite the MECs and the deputy ministers present, as well as the DGs, to join that one big family photo. Thank you. Books. If they may please bring their books that they've signed with them. Thank you very much. And I'll ask our colleagues from protocol to assist us in arranging the group picture. As they step into the front, let's please give them a warm round of applause. Thank you very much.
Yeah, you can come closer. We are a bit short, so you should be in the front. Yeah.
Okay.
You can squeeze in there.
Okay.
Should be fine, eh? Yeah.
Thank you very much. May the ministers remain seated and the acting president, while the MECs and the signatories leave the podium, the stage. I'd like to now invite the technical advisors, the advisors in the presidency, and all other senior officials who were part of this endeavor to come and join the ministers and the acting president for a picture. This is the final photo that we're taking. This way, this way, this way. Thank you very much. Thank you very much. At this stage, ladies and gentlemen, we've come to the end of the proceedings. I'd like to, on behalf of the acting president, to pass on our sincerest thanks for taking your time this afternoon and being with us. Thank you very much. Many thanks to the ministers and the acting president for making this day possible. Many thanks to the Deputy Minister, Dr. Phahla, the MECs, the DGs, and all other officials who've made this day possible. And also thank our colleagues in the media who've also joined us for today. Without them, the public will not be properly informed. I'm advised that Dr. Motsoaledi will make himself available should the media require further engagement and have questions. The Minister of Health will make himself available for engagements with the media. At this stage, I'd like to invite the acting president to take leave of us. And thank you so much, ladies and gentlemen. We've come to the end of the proceedings. Thank you. You've been a wonderful audience. Please give yourself a round of applause. Much better than you gave the acting president.
I see that.